We did our presentation on the nervous system, and my name is Mataya Lewis.
My name is Morgan Louis. Did you know there are more nerve cells in the human brain than there are in stars in the Milky Way?
The picture on the right is an illustration of the central nervous system, and this includes the brain and the spinal cord. The picture on the left is a combination of the central nervous system and the peripheral nervous system. The nervous system is a complex system that regulates and coordinates body activities. It is made up of two parts, central and peripheral. The central is the brain and the spinal cord. The peripheral is more responsible for everything else, including neural elements. The peripheral nervous system breaks down into the somatic nervous system, which is responsible for your voluntary movements, and then which breaks down into the autonomic nervous system, which is responsible for your involuntary actions. The last system is the enteric nervous system, which regulates your digestion. The body of the nervous system is tissue made up of two classes of cells, the neurons and the neuroglia. The neurons, aka nerve cells, communicate within the body by transmitting electrochemical signals. The neuroglia, aka glial cells, act as the helper cells of the nervous system. They protect, feed, and insulate your neurons. There are three classes within the neurons, which are afferent, which is sensory neurons, efferent, which is your motor neurons, and interneurons, which form complex networks within the central nervous system. Physiology of the nervous system has three main functions. The sensory neurons involve collecting information from sensory receptors. The motor neurons carry signals from central nervous system to other effector cells. Integration processes sensory signals that are passed to your central nervous system. These signals can be used for decision making or sometimes are just discarded.
These are two illustrations that show how complex the nervous system can be. Both of these illustrations show the central and peripheral nervous systems. Carpal tunnel syndrome. Carpal tunnel syndrome occurs when the median nerve becomes pressed or squeezed at the wrist. Causes of carpal tunnel include a combination of factors that increase the pressure on the median nerve and the tendons. Typing and texting are great examples of this. Treatments for carpal tunnel syndrome include medication, surgery, exercise, and alternative therapies, but exercise and surgery are the two most common. These illustrations are two examples of carpal tunnel syndrome. The picture on the left shows you where the nerve becomes compressed, right at the wrist. And then the picture on the right is a real-life photograph of someone who suffers from carpal tunnel syndrome. This is a case study that involves 28 patients with carpal tunnel syndrome. They were split into two groups. The first group was told to wear a splint day and night for 4 weeks. The second group was told to wear the splint day and night for 4 weeks as well, but they also performed tendon gliding exercises. At the end of this case study, it showed that 72% of the patients in group 1 reported good results, and 93% in group 2 reported good results as well. So this shows that with the tendon gliding exercises, group 2 improved more than group 1 did with just the splint. We're going to show you two exercises that help to treat carpal tunnel syndrome. The first exercise is called median nerve gliding progression. The second exercise is 3-fist tendon glide. Go. This first exercise is called median nerve gliding progression, and what you're going to do is stand an arm length away from the wall with your fingertips touching, and you're going to slowly take your hand, your palm, and put it flat against the wall. And you're going to do this about 15 to 20 times until it feels comfortable. What this is doing is stretching from the wrist right here where your tendon is. This exercise is called the 3-fist tendon glide. What you're going to do is start with your hands flat against the table in the supine position, open and flat. Then we're going to do 3 positions. The first position is called the hook position, and you're just going to bring your fingers into the middle of your palm and then back out into the open position. And you're going to do this about 5 times. The second position is called the straight fist, when you're going to bring your fingers all the way down, touching the bottom of your palm, and then back out to the open position, and you're going to do that about 5 times. The third position is called the full fist, and you're going to just make a fist with all of your hands, and you're going to do that about 5 times too. And that is the second exercise.
Peripheral neuropathy. Peripheral neuropathy is a type of damage to the nervous system, specifically the peripheral nervous system. And usually there is a problem with the nerves that transmit information from your central nervous system to the rest of your body. Some symptoms may vary, but a few of them might be tingling, numbness, or burning pain to any part of your body. It can also lead to paralysis. Causes for peripheral neuropathy can be inherited from your parents or developed because of an injury. Other disorders may also lead to this. Treatments for peripheral neuropathy include medications, which are not always safe, and exercise. Peripheral neuropathy is a type of damage to the nervous system, specifically to your peripheral nervous system. There is a problem with the nerves that transmit information from your central nervous system to the rest of your body. Your symptoms may vary greatly, but a few of them include tingling, numbness, and burning pain in any of your body parts, and it can also lead to paralysis. Causes are inherited from your parents or developed because of an injury. Also, other disorders may lead to this. Treatment for peripheral neuropathy includes medications, which are not always safe, and exercise. Strengthening exercises moderately improves muscle strength in people with peripheral neuropathy. Regular exercise may reduce neuropathy pains and can help control your blood sugar levels. So now we're going to perform 2 different exercises on what you can do to help reduce your peripheral neuropathy symptoms. The first one is called seated dorsiflexion, and the second one is going to be called calf raises. This exercise is called the seated dorsiflexion. What you're going to do is sit on the edge of a chair, and you're going to bring your heels and toes as high up as you can, and slowly let them down. You're going to do this 3 sets of 10 to 15 reps each. And to make this exercise more challenging, bring your legs closer to your body, like so. The second exercise is called calf raises. And what you're going to do is stand facing the back of a chair, and you're going to put 2 fingers on it for support. And then you're going to stand on 1 foot, and you're going to bring your heel up and lift your body up and bring it back down slowly. And when you're bringing it up, it's going to be strengthening your calf muscles. You're going to do this 10 to 15 times on each leg.
And that was our presentation on the nervous system.